Hey guys, welcome back to part 2 of our interview with Dr. Utz. If you missed our last episode, click on the link, but if not, sit back, relax, and get ready as we bring you the latest news in arthritis. Now! So what is the best part for you about being a researcher?
I have a lab that has about 8 or 9 people in it. And so one of the best parts of my job is mentoring those people, helping them come up with good ideas, interpreting their data. So that to me is one of the most satisfying.
Yeah.
And then the other is starting new programs. I really like to build things. So I have a high school research program that we have many people who are doing research now in autoimmune and immunologic diseases as part of that program. We had 60 students working in labs this past summer, selected from a pool of 1,200. So that really, for me, is a lot of fun to have started that and to have built it to the point where it is now. I've been running it now. This will be the 15th year.
That's great. You're kind of ushering in a new generation of potential scientists.
Absolutely.
We have Kathy Mallon asked this question. Do you have a test to see if it is safe for us to use biologics? When looking into the rare times when biologicals have caused the NHL, do we know, if at all, if they took MTX or cyclosporin prior to biological medications?
So I can answer that. That's a great question. Tell me the name of the viewer again.
This is Kathy Mallon.
Kathy. So what Kathy is referring to is that some of the drugs that we use are associated with the development of a type of blood cancer called lymphoma. NHL is Non-Hodgkin's lymphoma. And it's been associated with tumor necrosis factor inhibitors. Kathy, there's 2 things you need to know. One is that diseases like lupus and rheumatoid arthritis are themselves associated with a much higher risk of lymphoma because patients who have these disorders have a messed up immune system. It's not normal. And our immune system gets rid of tumors every day. All of us develop millions of tumor cells every day, and our immune system eliminates them. So when your immune system doesn't work normally, just because of the disease, you're more likely to develop lymphoma. It is thought that the drugs that we use do further increase that risk. The risk from methotrexate and cyclosporin is probably also does exist, but it's probably small. So there's really no way to know if you would have developed this lymphoma from the methotrexate or the cyclosporin. Right now, there's no tests that have been developed to predict that, although we certainly are trying to do that. And the other thing we're trying to do is to develop therapies that improve the disease, but don't put you at risk for these lymphomas. So the long-winded answer is there's no test right now that can predict it, and there's a strong association with lymphoma and the disease itself, regardless of whether or not you have any treatment for it.
Awesome. Thank you very much, and thank you, Kathy Mallon, for providing that awesome question. And so we want to give our viewers here a good idea of what a researcher does in a lab, and so what is one thing as an investigator that people might not necessarily think is part of the job description?
I would say if viewers really want to know the sad truth about biomedical research at universities, it is that most of our time now, sadly, is spent in writing research grants. That's why groups like ANRF are so important to our research.
And just to your point about submitting the grants, that just says a lot to believe in your idea and just to not stop trying until you get it.
Absolutely. If you believe that something needs to be solved and you put the time in, I feel like that some of the things that we work on are such big problems. Hopefully we can make a dent in it, but we're probably not going to solve it in our lifetime. But there have been some huge breakthroughs now that make us all think that diseases like lupus and RA, we might be able to cure them one day.
Great. Well, yeah, thank you so much again for being with us today, and we look forward to hearing from you soon.
Absolutely. Thanks again for doing the interview.
Yeah, no problem. Hey guys, thanks for watching. Don't forget to subscribe to our channel and check us out at curearthritis.org, where you can find out more about the foundation. And don't forget to do your part to spread arthritis awareness, so together we can get one step closer to finding a cure.